Mm.
So whatever each one of us is doing or not doing, because not doing is also a doing, we are doing for the best reasons that we know in that moment. But it changes everything if we can engage with our fellow humans from the perspective that there is nothing wrong. And that's not easy. That's really, really, really not easy. And I'm saying that, I'm very aware that here I am, sitting in an office in Prague, talking to somebody who's sitting in Israel, saying there's nothing wrong. But actually, when we experience it and we hear it, and we hear it in our body, we know that there is a truth here. What is required for me to be able to live from that, or at least to live towards it and open up to it?
Welcome, dear audience, to another episode of Beyond Circumstances. And today, my guest is Dr. Kim Jobst. Welcome, Dr. Kim.
Welcome, Shiri. I think we're
Lovely to
both
have you.
guests today, aren't we?
A little bit, yeah. I'm going to start by saying a few words about how I know you and why it was important for me to invite you to dance with me today in this episode. So, we met earlier this year in the US around a project that we might collaborate on. And I remember you sat in the room and you said nothing at the beginning. And I was like, who is this guy? What's his deal? Like, your presence was believable. And then I asked a mutual friend of ours, so who is this guy? What's his deal? And says, this is Kim. And he holds the flame. And I'm like, okay, I need to know this guy. And we spent time together and we got to know each other. Since then, we share a very special connection and a beautiful friendship. And when I started this podcast, I said, okay, I want to dance with Kim. I need to do an episode with Kim. So welcome. Thank you for saying yes. And
Well, thank you for that introduction.
my pleasure. So, my dear, please say a few words about who you are, what you do, what you love, anything that's important for people to know about you, for those who don't know you yet.
Well, actually, your introduction touches me very deeply. Because there is a mirror here, because you also didn't say much for quite a long period of time. And I thought, who is this woman who moves as if she owns the room? And she did, and does. Who am I? Good question. Well, in the simplest sense, I mean it. In the simplest sense, I am spirit made flesh, and I've had a very full and very rich life to date. So in orthodox terms, I'm a physician, and I'm a physician in the original and deep sense of the meaning of that word. I love the word physician because a physician is one who attends to more than just the mechanical system. At least that's what a physician used to be. And it's what I feel is what medicine is crying out for, which was the basis of the project on which we met and what we were working on when we were in the States. I've had a career of 40 years in medicine. The label that goes with me is an integrated medicine physician. But 2.5 years ago, I let go of my license to practice because I really wanted to go much, much deeper into what had led me into becoming a physician in the first place. And that is the meaning of life and how it works. The last 5 years and what we have all experienced through what I call COVID, the biggest con in human history, has exposed such profound challenges for me personally surrounding my profession, where it comes from, where it's going to, what it's actually about, that I felt an imperative to go much deeper, much, much deeper, and to explore more how meaning drives every aspect of our lives, every aspect of our lives. And of course, that's particularly significant in medicine, but not just medicine, it's every aspect of the healing arts and sciences, but so much more. And that, where you and I began our deeper exploration was what has been labeled diseases of meaning, the document that I wrote and that I'm very happy to make available to people if they want to have it. And that was published back in 1999, although I started writing it in 1991. And I just been rereading aspects of it. It's probably more relevant now even than it was then. It's what really drives me through the course of my career, which has embraced, the very best of modern biological medicine, genetic medicine, pharmaceutical medicine, and the widest reaches of the so-called alternative. I've been really blessed. I mean, it's hard work, but I've studied and practiced in a number of different dimensions. And all of those things taken together have led me to the inescapable conclusion that our lives actually fundamentally revolve around meaning. So that's my personal and professional perspective. I'm also a father of 4 absolutely amazing human beings, all very, very different. And I enjoy a very rich life.
Thank you. I love that you use the word physician. And I got a glimpse of that side of you when we met in the US. I had a bit of a crisis, and I was blessed to have you by my side because it was your presence there sitting with me in uncertainty and that allowed me to invite another meaning into that moment. And you didn't try to fix anything, but you brought a healing energy. You were a physician in that place. And I remember that, later on, and I think we also spoke about that, I had so much respect for you for being there for me the way that you were, because oftentimes when I do workshops with physicians and I introduce uncertainty, they freak out because they are taught to fix uncertainty. Okay, wherever there's a question mark, their job is to provide an exclamation mark. And I don't know if there always is an exclamation mark.
No, actually, it's interesting. I had quite forgotten about that episode until this moment. And it's paradoxical what you're saying, because on the one hand, a physician, whether in acute medicine, emergency medicine, or in surgery, or whether working in other dimensions, is actually all the time living and working with uncertainty. But the paradigm has become so involutionary that it is seeking, one could argue that it is seeking all the time to try to make certainty out of uncertainty, which is not unreasonable, but somehow to put things into boxes that can be labeled and dealt with in such a way that minimizes the uncertainty. And you're right. In that particular instance, which I guess we don't really need to go into detail, but I had absolute certainty, interestingly, that to do anything orthodox would have been potentially fatal. And that meant making an active decision, for me personally, to sit in the uncertainty and to trust your system.
And that gave me a lot of confidence. And oftentimes, this is a question I always put in the space. because I think we are so confused about how to navigate crisis or move beyond circumstances. So oftentimes those circumstances of a crisis, involve uncertainty, or else it wouldn't be such a crisis. We would just know how to fix it. From your perspective, what is one thing, or maybe more than one thing, that people get wrong when they try to create certainty or move beyond circumstances that are uncertain?
Okay. So I think what we're going to do together and with our listeners is go from a standing start to the center of the galaxy and beyond in one leap.
Let's do it.
The first axis about which this revolves is that there is nothing wrong. So whatever each one of us is doing or not doing, because not doing is also a doing, we are doing for the best reasons that we know in that moment.
Hold on, that's a really, really powerful premise you're putting in the space. So may I ask you to repeat it? Because that's
Yeah,
really
absolutely.
powerful.
Whatever we are doing or not doing, because not doing is also a doing, and by analogy, doing is also a not doing. We are doing for whatever we perceive to be the best and most appropriate reasons at that moment. Now, we may not understand what has led us to that, and most of the time we don't, but it changes everything if we can engage with our fellow humans from the perspective that there is nothing wrong. And that's not easy. That's really, really, really not easy. And I'm saying that I'm very aware that here I am, sitting in an office in Prague, talking to somebody who's sitting in Israel, saying there's nothing wrong. But actually, when we experience it and we hear it in our body, we know that there is a truth here. What is required for me to be able to live from that, or at least to live towards it and open up to it? Once that happens, we can embrace and approach any situation with a different attitude. And that attitude demands presence. And it demands presence because it requires attention, and it requires attention to detail depending on what the situation is that we're dealing with. And every situation is different. In medicine, where we experience it particularly is in the emergency room, or in surgery, in intensive care, in coronary care. We meet crisis, we meet uncertainty. And in order to be able to address that as effectively as possible, we need to be attentive to detail. We can be together in the situation that we found ourselves in the US, where one response would have been an orthodox response, which would have led to a completely different series of outcomes.
Mm-hmm.
Or we can stay in the moment and meet the uncertainty and be as present as we can and really listen. And then we get guided, and we're guided by something else, because it's in those moments that we have the opportunity to open to intuition. And intuition is the most amazing teacher. At least that's my experience.
Yeah. So what would be the role of intuition when trying to create certainty in uncertainty?
Well, these are all about states of being, because to create certainty in uncertainty paradoxically also means just being able to be present. There is certainty in presence. So being present in the midst of uncertainty opens us, at least again, in my experience, I'm speaking from experience, to intuition. We start to hear, we start to sense, to feel. Something says, don't do that. And that something is a faculty that we can develop. It's a skill that we can develop. And, I was very fortunate in the early days of my medical training to have been exposed to some truly great physicians and surgeons at different times who were certainly at that time able to step away from the textbook and teach us from their embodied experience. And their teaching from embodied experience was much less didactic than it was, come and be beside me, watch, help me, listen to this. in my experience, when one hears this, it's kind of leading in such and such a direction. It brings back to mind as something I've shared often, but it's worth repeating. And that is on my very first day of medical school, in my very first lecture of medical school, the professor of medicine at St. Thomas's Hospital was a man called Bill Cranston, who was from Scotland, and he used to wander and do all his work with his spectacles on his forehead. And he walked in to take that very first lecture on the very first day with us, brand new, wet behind the ears, young physicians in training. And the first thing he said was, listen to your patient. They will always tell you what is wrong. I've never forgotten it.
One thing that I often say to my clients is speak up. Let your physician know what you think.
It's extremely important.
Yeah.
But they're not always heard.
True.
They're not always heard. And they're not always heard. And this is where, for me, medicine as a profession, and I'm generalizing, and I'm aware that I'm generalizing, has in a sense been losing its soul. And that is that people need help to hear, to listen. Scary.
Yes, it is.
Scary. You know that.
Yep. I do. Oftentimes when I speak with clients and I talk about intuition, the request that they present is, so how do I do intuition? How do I'm in a bit of a crisis. How do I tap into my intuition? How do I know that the intuition I'm tapping into isn't just my fear? How do I do intuition?
Well, you can't do intuition in my experience. And yet, there are things to do and to be. Again, my experience is that intuition is always available to us, 100% of the time. 24 hours a day, 7 days a week, 365 days of the year. Our ability to tune in, to open to it, is a totally different story. And I'm really speaking now on the hoof because I've never sought to categorize it in this way, but my body is integral. So being able to be aware of my body and to be in my body, my heart is essential. My being willing to open all my senses, to listen, be attentive to detail, and genuinely to want to know. I mean, not just a two-dimensional piece of give me the information. This is like, show me, tell me what is really needed here. Mm-hmm. And then being willing to receive what comes, because when that happens, when we're in our body, we're open, and it's not always easy to live in one's body with one's heart open, one's senses wide open, and this thing that's trying to find answers all the time, quiet.
Yeah.
Like the event that we shared together, the response comes, don't do anything. Stay present. Yep. Stay present. Stay present. Yeah, but what? And that capacity grows. That can be cultivated. Yeah. No question.
I find that it's strange, but oftentimes when I work with people that are going through a medical crisis, the most challenging part, there are two challenging parts here. The first is being in the body, because the body just betrayed. And sometimes the body is a hostile vessel because it's causing pain. So how do we extend an invitation, or what could be a new way of being in the body? When the old agreements, the old emotional contract that we had with the body, where we can trust unconditionally and the body is just going to carry us and do our bidding, that's broken.
Well, I'm right there right now. My body is giving me feedback of a certain kind that is making ordinary life and movement very, very difficult. It's a bit like your question at the very beginning. There's nothing wrong. So that applies equally to my body. Now, I don't mean there's nothing wrong and therefore there's nothing to do. Of course I don't. But it's first of all to trust that whatever it is that we're experiencing is the body responding the only way it knows how, given my level of consciousness at that given moment. And it brings one face to face with a huge amount of uncertainty. Certainly in my own experience right now, I want to fix it. I just want it fixed. But to fix it in the ordinary sense of the word will mean me doing something that at a very, very deep level I don't want to do, which in this instance would be pharmaceutical. And I don't want to do that because I know my body's giving me feedback that I need to listen to. And I think that's the case for everyone. And, diseases of meaning is all about that. It's all about that. Every symptom, our symptoms, are potentially infinite. Our symptoms are language. They are language. They are part of the most exquisite, complex, extraordinarily sophisticated design that enables us to fulfill more of our potential as a multidimensional and multifaceted being. That's my current perspective.
I love that. What needs to be said and we haven't said about moving beyond circumstances?
That we moving beyond circumstances is only possible by being fully present to the circumstances that we're in. And so let me return to you with a question. What did you have in mind as a circumstance that gave rise to that question?
I didn't have
Make it
anything
practical.
specific except maybe the energy that was in me when as I asked that question had to do with chaos. So chaos can be different things. It can be war and it can be divorce and it can be bankruptcy and it can be an illness, a diagnosis, a medical procedure. It can be so many things. It's something that gets me completely dysregulated. So my anchors are no longer accessible and things do not make sense. That's chaos for me. I think those are the circumstances that, people often struggle with because if it's familiar and you've done it before, you copy paste the old protocol. But the whole idea of moving beyond circumstances is when you don't have a protocol or the old protocols just don't work. I think that for me, a lot of it, being in the moment, being present has to do with non-attachment. What are you being present with? Is it the story? It's like, are you willing to be present with a sense of having a story and not being the story? It's interesting.
At this stage in my life, whilst I have not been present to war in the proximity that you are, but I'm nevertheless on a planet that is at war in many different places all at once. And I'm more and more aware that what we perceive externally is a reflection of us internally. And the profundity of that is deeply shaking because it means somewhere I'm responsible, which is a challenging thing to say. Again, here I am in Europe and there you are in Israel. But nevertheless, my state is part and parcel of the whole. So to move beyond circumstances is not about escape. I don't think we can actually move beyond circumstances. I think the option that we have is to be more fully in them and then to see more, experience more, understand more. So as we go deeper, we begin even to experience that the chaos, the apparent chaos of the war is nevertheless a component of an extraordinary order. And it's a challenging thing to say. It could be a challenging thing to hear for some and not for others. At this point, I have no doubt any longer that our entire existence is in divine order. So my duty then is to live and work to the very best of my ability to understand it, to see it, to experience it more and more and more deeply, so that wherever I am in the world, I can bring that with me.
Yeah.
And I think that that's a form of light. And, it's what I personally experience when Wayne says, I'm the keeper of the flame. That's the flame. That's the flame. It's light. And that ability to see, and which we can glimpse, the order, the divine order, brings order and it illumines things.
And I think there's an invitation for us to make choices from a different place.
Totally, totally.
My dear, time flies when we're having fun. And this has been amazing. It's been a wonderful conversation, a wonderful dance. Thank you so much.
My pleasure. My pleasure.
So
And
where can
privilege.
feelings mutual? Where can people find and learn more about you and the work that you do? Because you've been doing some pretty amazing things lately.
So there is a functionalshift.com website, which is about my old life, really. But there is a website now called Constellos. We haven't talked about that aspect of my work. CONSTELOS.com, which really embraces the work that I've been doing with Clara Varvova in bringing meaning and a deep, deep dive into the unique meaning that every human's life has and what that is for them into constellation. We've been taking that work in, so people can find me there.
And I'll put a link so it'll be easier to find you because that's mind-blowing stuff.
That's the passion stuff. And we'll make available diseases of meaning to people, maybe. We can
Yes,
do
we
that.
will. I'll put another link. Definitely. Definitely. My dear, thank you for the
And
gift
they
of
can
you.
email me.
I'll
Pleasure.
put a
My
link to that
goodness.
as well. So thank you so much for saying yes and being my guest.
Pleasure.
And to our audience, thank you so much for joining us today. So if you're a coach and you want to learn more about how to support your clients through life's challenges and uncertainties, please tune into the next episode and find us on social media for more content and trainings. And thank you so much. See you in the next episode.
Bless you.